18-year-old kid, suddenly an orphan and a single father of two.
Party of five. Powerful stuff. The OC of its day. Stress explains everything except the itchy feet.
Athlete's foot covers that. Waiters work 12 hours a day in old sneakers.
Good idea. Ignore the symptoms. Makes her job easy.
I'm not ignoring a symptom. I'm explaining a symptom.
Kid's been hanging over a toilet despite antiemetic therapy. Persistent vomiting could indicate increased intracranial pressure, tumor.
Sure. Heart problems. It's got to be the brain. Thank God there's a neurologist in the room.
Right. It's the feet. If only I were a podiatrist.
Probably caught an intestinal virus from one of those feral kids running around. Repeated vomiting causes an electrolyte imbalance, which leads to an arrhythmia, which leads to the heart attack. And itchy feet.
Nope.
That's it? Nope.
I've said too much already.
This isn't a game, House.
No, it's not. But it could be.
What are you writing?
Nothing.
If you know the diagnosis, why don't...
How are you going to learn to swim? Unless I take off your floaties and throw you into shark-infested waters.
You can't know what's wrong after a 30-second perusal of his file.
Apparently you can't. Now, what's a game without rules? No tagbacks, no biting. You get one test each, and the clock runs until lunch. If I'm right, you'll still be alive. If I'm wrong, this is a very cruel game. How are the feet? They still itch?
Is that important?
I don't know. Is it? What kinds of drugs you into?
You don't have to talk about that right now.
No, it's okay. I don't keep secrets from them. They know I did drugs before our parents died.
Clever. Admit the past, deny the present.
I'm clean. I'm raising two kids. It'd be pretty irresponsible, wouldn't it?
But confiding in an 8-year-old is okay.
If I'm open with them, then they'll be open with me.
Yeah. Turning the other cheek's a good strategy in boxing. Kids don't lie because they got trust issues. They lie because they got something to hide. Look at him. Sitting there doing nothing. He's still lying.
We don't lie to Jack.
Spelling test you failed or forgot to?
No.
Math test?
No.
Fight with the kid sitting next to you?
He doesn't sit next to me.
The other one's probably having sex.
I am not.
Yet. But when you start, you're gonna lie about it.
Is your arm hurt?
Arm's fine, bro.
Then why is it bleeding?
It's not.
Raise your arm above your head.
Your ear. And your nose.
Osteomyelitis. Means you're wrong about foodborne toxins. And you can stop too. It's syphilis.
You sure?
Read the printout.
He's also positive for Whac-A-Mole.
One of you two screwed up.
No.
Not a chance.
Boy, this kid is a lot sicker than we thought. Finish that test. It should be impossible to get 2 right answers to 1 question.
It's okay to have 3?
Apparently. He's positive for botulism, too.
So, we knock down 1 infection and 3 more pop up. I think this game is rigged.
Jack? Somebody help!
Brainstem's clean.
Nothing in the midbrain.
What's that? Frontal lobe, upper right quadrant.
I don't see anything.
Yeah. It's tiny, but I think it's a tumor.
That size should be excisable. Why didn't we see it earlier? How
Oh,
could...
God. Axial view, there's another one. Bring up the next slice.
They're everywhere.
Little orphan Annie and Oliver Twist slept in our hallways last night.
Are they sane?
They're children. They need a guardian.
Couldn't find a babysitter on account of not being able to make any phone calls, on account of not being able to breathe, on account of his lungs filling up with serratia. He has chronic granulomatous disease. Game over. Our work is done.
Then he's gonna keep getting sick. You gotta call social services.
Bone marrow transplant would reboot his whole immune system. He'll be healthy enough to win miserable Daddy of the Year.
So see if one of his kids is a match.
My kids are already testing his kids.
You tested him? I never consented for
It's
that.
just a blood draw. There's no danger.
To the testing, what about the surgery?
The risk for Will? It's next to nothing.
What if I don't do it? What are my other options?
Your immune system can't fight off the germs we all come into contact with every day. Now that we know, we can use more targeted medications. But you'll still get sick all the time. You'll be in and out of hospitals.
But I'll live.
Jack, your lifespan will be substantially shortened. And you'll be too sick to care for your brother and sister anymore.
You shouldn't have pressured him into
There's no pressure.
He's 8 years old. You tell him his brother's dying unless he helps, what do you think he's gonna do?
He wants to help you.
He has no idea. It's like you asked him to let me play with one of his toys. This is surgery. He could die.
He'll be fine. But you're gonna have a hard time protecting him like this if you're dead.
I'll do it. When Will's 18 and can decide for himself.
It's your lucky day. Just found another donor in the registry. Perfect match. We can do the transplant, no danger to the rug rat. Just have to sign here. Unless there's another reason you don't want it.
There's a chance I'd die.
Chance you'll be cured. Maybe you don't want that either. Maybe hanging out in a hospital, getting weighted on hand and foot reminds you of what life used to be like before you were forced to play Mr. Mom.
I don't like being sick.
But you don't want to be healthy either. This is your way out. Guilt-free.
I said I'd do it when Will's 18.
He's able to take care of himself without you.
Jack, your brother and sister need you.
I know every second of every day that they need me, but I'm too young to be their dad.
Good for you. Don't pretend you're surprised.
Thank you for not telling them.
You're a good kid. 3 months from now, 6 months from now, you'll be visiting them, and you won't be able to say goodbye. You're gonna know you screwed up. You'll take his bone marrow, and you'll take them back. And there'll be a burden and a pain. And your life will never be what it was supposed to be. But you'll be proud of yourself. Your parents, they'll be proud of you.
I don't think so.
It's what I want to believe.
She got sick in the middle of her 14th birthday party. Which is sad and pertinent. Maybe she was opening a present that triggered the reaction.
Who's that?
Pissing contest with Foreman.
Last thing she ate was strawberry cake, but allergy tests for everything were negative.
You like your dentist? I'm still going to my pediatric one. What's your dentist's name?
Williams.
What if it's not an allergic reaction? Hereditary angioedema or systemic mastocytosis could mimic anaphylaxis.
You're not sure of his name? You just saw him this morning.
The assistant's name is Angie. Her home number is...
Normal complement studies, no skin lesions.
You had a manicure. This is fresh. You weren't at the dentist. Why would you lie about that?
To avoid having this conversation.
Elevated BP. What about pheochromocytoma?
Or an anaphylactoid reaction which could be triggered by certain opioids.
You've had your hair cut 3 times since I've met you. You can't be embarrassed about a manicure. There's gotta be a deeper reason.
Did House give you homework?
She's not on any meds.
Haven't you heard? Everybody lies.
And the tox screen was clean.
Feel free to jump in at any time.
We'll check catecholamines for pheo and run an expanded opioid panel. You see what the patient says about drug use when her mother's out of the room.
No, never.
Nobody's here to bust you, Iris. We just need to know if...
No, I already told you. I just take vitamin C sometimes.
What exactly were you doing when you had your reaction?
Opening a birthday present. The magic 8-ball. The joke gift, not the cocaine. Is that it?
Certain drugs could explain her reaction.
What kind of drugs?
What kind did you have in mind?
Iris has always been a moody girl, and now that she's a teenager, it's gotten worse. So for the past few months, I've been giving something to relax her. Diazepam. I tell her it's vitamin C. Being normal is very important to Iris. She couldn't handle the thought of being on meds.
Anti-anxiety medications would explain it. If we keep her off, she'll be moody, but healthy. Or it's something else.
Feeling any pain or cramping here?
A bit. But not just there, here.
Breast tenderness. Have you been having regular periods, Iris?
Not really.
What is it?
I think we should run a pregnancy test.
Iris isn't sexually active. She doesn't even have a boyfriend.
Pregnancy would explain all of her symptoms, can even cause some unpredictable allergic reactions.
How can I be pregnant if I've never even had sex?
We just need a drop of blood.
What's the matter?
My arms. I can't feel my arms.
Blood work was negative for HIV. All the money's on tumor.
How was the Brazilian?
It was fine. Hurt a bit.
What about House's theory? Why'd you really do it?
Because I'm vain and shallow.
And you weren't before?
Girl I was seeing wasn't. There's nothing profound here.
No tumor either. It's not her brain. Everything looks good.
What's the matter?
My arms.
Still nothing?
Oh, now they're sore.
Paresthesia's gone.
Could the bruising be caused by physical trauma?
You think she fell out of bed repeatedly?
A blood disorder, maybe thrombocytopenia.
A vitamin K deficiency or scurvy could explain bleeding problems, and pregnancy could exacerbate it.
Boys do a home search, girls do lab tests. Pretty sure that's not sexist.
I met him at school. He was the only boy that liked me.
It's a little more than like.
We haven't had sex.
Oh, come on, Iris. You're pregnant.
So I'm just lying about everything?
Well, you lied about the boyfriend. You obviously lied about sex and this garbage.
They're his. He can't keep them at his place.
Well, I'm glad we could be so accommodating. What else don't I know? Honey? What is it?
He came here last night, and he told me I should leave. But I didn't want to, and he got mad.
He hit you?
Physical trauma.
Explains the negatives of the blood disorder.
We should call the police.
I won't tell them anything.
That's ridiculous. He beat you.
What is it?
It's getting hard to see. What the hell is happening to me?
MRA was normal.
Yeah, how did
I
you...
found out where your boyfriend lives. When I paid him a visit, he took off. Ran in front of a car.
You're lying.
He's down in the ER right now.
Shut up, you lying sack of crap.
Iris.
How do you know I'm lying? How do you know your boyfriend's okay?
'Cause I'm right here, you dick.
Iris has dissociative identity disorder, also known as multiple personality disorder.
Are you saying I'm crazy?
It's the mind's response to a severe trauma. A person experiences something that's too difficult to accept, so they create alternate personalities that don't have to accept it. Some think it's quite a natural reaction.
Iris hasn't had any severe traumas.
The car accident?
I was 2. I don't remember anything. These personalities that I'm supposed to have, where are they?
They only come out when you're afraid or anxious. That's why House used the hurt boyfriend story.
But if there's no boyfriend, where did the bruises come from? The pregnancy?
When you say your boyfriend hit you, it means you actually hit yourself.
And the pregnancy, Doesn't take a boyfriend, just a boy. You may not be aware of half the things you've done.
How could this be happening to my own daughter without me knowing it?
Diazepam was masking it. Taking her off made it more apparent.
But I wasn't on diazepam. What is that?
That's what those vitamin pills were. Iris, I am so sorry. I thought you were moody, and I didn't want you to think you needed medication. Oh my God, I can't believe how stupid I've been.
We need you to help us with something. Different alters can have different apparent symptoms. Allergies, paresthesia, vision loss, changes in blood pressure.
Do you think I'm making this up?
Your symptoms are real, but some are physiological and others are psychological.
So there's something wrong with her, in addition to the multiple personalities?
Yes, but we won't know what until we access her alters and compare their symptoms.
Well, how do you do that?
Hypnosis.
Who am I talking to now?
Nobody.
You must be somebody.
I'm too little. Nobody sees me. Nobody knows I'm here.
PB just went to 140 over 90.
What is it?
My arms.
You can't feel them? It's okay, we can fix that. Do you hurt anywhere else?
Not right now.
That you used to hurt?
When I eat strawberries. When I remember.
You remember being hurt?
I remember everything.
Baby. It's going to be okay.
Why didn't you ever tell me?
It was my fault Daddy died.
Oh no.
Yes, it was. I was crying and he couldn't drive. It wasn't my fault, Daddy.
Oh no. No, honey. You were just a baby. It wasn't your fault. No, shh.
It's my fault. I'm sorry.
Yeah, no, it's not like it's serious. I checked online and it's asthma or something.
Or something is the #1 killer of teens with no medical degree. When was the last time he took you to see a doctor?
Like 5 months ago, we went to a clinic in Trenton. I had strep throat.
Remember the antibiotic they gave you? Is it neomycin?
Amoxicillin. So about the inhaler for my asthma, I was...
Sorry! Hospital policy specifically prohibits me from giving meds to unrelated homeless people pretending to be father and daughter. Your pants are a size too short. Either you grew a couple of inches or you grabbed the closest size in a thrift store. And only you have dimples, which are adorable, but they're also an X-linked dominant genetic trait. Which actually doesn't prove anything. The fact that she didn't burst into tears tells me that you never thought he was your dad.
Let's get out of here.
Since you're the brains of the operation, you might want to stick around.
What, so I can get busted by social services?
No, so you can stop bleeding out of your ear. It's usually a sign of a skull fracture. Someone been using your head as a soccer ball?
No.
Much as I'd like to take your word for it, I have no interest in taking your word for it. No tenderness, no pain. Looks like you might actually be telling the truth about something. Ear canal is fine. You don't have a fever. Pay the man. He's late for a trash can fire.
Could you tell me what's going on? What's wrong with me?
I have no idea.
When I was your age, I ran away. Lived on my own. At the time, it seemed...
Oh, let me guess. Life with mom and dad was kind of a drag, so you just ran away, lived with friends, and partied with guys that you knew your parents would hate. And then when you got tired of being a rebel, you just went home. Being homeless isn't a vacation for me. And I'm not acting out. My life at home sucked, so I got the hell out of there.
There are other options besides living on the streets.
Right, like group homes where you're packed in with as many messed up delinquent kids as possible. Foster parents will only take you in because you're a meal ticket.
I can think of easier ways to make $175 a week.
No, you're right. I really should roll the dice and hope for a pair that don't ruin my life the way that my mom... Get your hands off my stuff!
Stuff might tell us more about why you're sick. A history textbook. You go to school?
Well, I don't plan on being homeless forever.
Plenty of food, water.
And beer?
She eats well, goes to school, makes good grades. She's a homeless girl who's captain of the volleyball team.
How can you be okay with this? Your mom sends you to work with snacks.
I want and need parents. Jane Doe is flourishing without them.
Maybe. But this mole definitely is.
She responding to corticosteroids?
Looks like it. And social services.
Thought for sure there'd be some yelling or profanity, possible bloodletting.
She's tired of living on the streets after all. I bet house regret. Could he know I'm good with a gun?
I don't know how, but
Hiring a hooker to pretend to be a social worker?
She took a bet that she knew she'd win. Frankly, I feel violated.
What happened to the social worker I called?
Apparently someone identifying themselves as Dr. Pujols called and said the patient ran off.
Come on. Pujols.
I've informed social services of the mistake and given Jane Doe's description to the cops. They'll track down the parents.
Thank you. I'll leave you and Dr. Pujols alone.
I heard the nurses talk and you called social services for real.
Because you shouldn't be living on your own.
Right, better my mom should use me as a punching bag.
if your mom abused you, social services won't let you go home with her.
Have I mentioned I don't trust the system?
We don't know if you're better yet. You can't just take off.
Can we help you?
I'm Adele Brown from Social Services, and this is...
I'm Ellen Rogers, Callie's mother.
You haven't been that for 2 years.
I promise. Things are different.
Wow. 2 sentences in and you're already making promises.
Okay, maybe we need to take a minute here and give Callie some space.
No, I don't need a minute. I need her out of my life.
Is she okay?
I will be once you just...
Oh my God.
We need help in here!
Will the endoscopy be painful?
Is that an issue? It's a medical procedure. There will be some discomfort.
I never meant to hurt my daughter.
And yet you hit her.
She told you that.
And now you're gonna tell me you didn't.
I'm a drug addict, and I've been a lousy mom. Especially since my husband died. I mean, he was closer to Callie than I was, and I missed him so much. And it was too hard. And taking Oxy just made things easier. Right up until it made me lose my daughter. I hurt Callie a lot. But one of the only things that I can feel okay about is that I never hit her.
You think people can change?
No. But I don't think that's going to change your opinion because people don't change.
Stop. Is that an ulcer?
Yeah, it is. But we haven't reached his stomach yet. I'm still high in the esophagus. Means it's not Zollinger Ellison.
Ulcer's bleeding.
I need to lavage before she drowns in her own blood.
Social services report came in on your mom.
And let me guess, she passed with flying colors. She always does.
I think she might make it this time. House left a bottle of Vicodin to see if she'd steal it. She gave it back.
could at least let her sleep in the room.
She could have listened to me about my drinking. I mean, even if you are right about it, why take your word over mine? I'm her daughter.
Because she's your mom. And for the first time, she's acting like it.
It's a little late for that. Good night.
This will only give us a couple hours max.
What causes breathing issues, bleeding issues, paralysis, loss of consciousness? What are we missing?
That's everything bad that's happened. What about the good stuff?
You mean like we should be more optimistic?
She got a little better when we put her on steroids, which can attack tumor cells. Maybe she has cancer.
No hypercalcemia, no elevated blood proteins.
She and her mom mentioned a trip they took to Florida a couple years ago. What about dengue fever? Cholera?
Great ideas if dengue fever or cholera laid in wait for 2 years before suddenly... Did your biological daughter go swimming in Florida? In a lake or a pond or an Everglade?
Yeah, there's a canal near my mother's house. Do you know what's wrong with her?
Family vacations kill. Come with me. I want to explain this twice.
Letting in the flies. She needs to know that.
No, she doesn't. Your daughter has ascariasis. It's a disease caused by a parasitic worm found in feces. Animals use the canal as a potty. The eggs for the feces end up in Callie's intestine when she went swimming, where they hung out quietly and asymptomatically, biding their time. Till somewhere along the way, they got knocked loose. Maybe died in volleyball practice, or maybe she slipped on her way into a soup kitchen. But once they hatched, the worms got to work on her lungs, her ear, nerves in her legs. The worms got agitated by the steroids we gave her, which started them on their journey to the esophagus and ultimately to the heart. A few pills of mebendazole, she'll be fine. Our new patient, part girl, part boy, all 13's dream date.
Severe pelvic pain started during a basketball game. Could be dehydration.
You already gave him fluids when he came in.
Still, if it was chronic.
They got a kid could mate with himself, and we're thinking he didn't have enough to drink. There are dozens of intersex disorders. Persistent pelvic pain could mean congenital adrenal hyperplasia, PMDS.
Those conditions occur in intersex kids who are chromosomally XX or XY, not XX and XY. Parents recently started him on testosterone. Maybe there's something...
Vitamins wouldn't cause pelvic pain. There's a note in here. We're supposed to refer to his testosterone shots as vitamins. His parents aren't just liars. They want us to be liars, too.
I won't do it. You guys will, though.
He's a kid. Parents don't think he's ready to deal with it.
My dad was the same way about me maybe having Huntington's.
Well, that was your experience. Must surely apply in this situation.
Pain could be caused by a blind uterus hidden in his abdomen. He needs an MRI.
Right. Boy with girl genes. I'm sure you're the first doctor brilliant enough to check for a uterus. He could have complications from the surgeries on his penis. That can cause pelvic pain.
Way to multitask. Impress your boss and humiliate your ex. MRI is a waste of time. To continue the humiliation, you'll put a camera up his penis.
Testosterone blocker? Does that mean if Jackson has SLE or whatever that other thing was, that he'd have to go off the hormones?
Probably.
Then Jackson will stop developing. He'll never go through puberty.
Maybe this isn't what's wrong with him. I mean, maybe the testosterone didn't cause it.
Yeah, but if it is, then he'll never be a man. Did we make the wrong choice?
You'll need to tell him the testosterone blocker is something else.
Or maybe this is a good opportunity to tell him the truth. It might make it simpler for all of you.
You want us to tell a sick adolescent boy that he's really not an adolescent boy? That doesn't seem simpler to me. No. Just give him the meds.
If I have this IV, why do I need a shot too?
Just some extra medicine, just to be safe. I hear you're quite the basketball player. What position?
Point guard.
Small forward. How's your crossover dribble?
It's okay. I'm not really that into basketball.
Gonna feel a little pinch, okay? So if you're not that into it, why'd you join the team?
My mom kind of made me do it.
My parents were the same way. Always pushing me to try new things.
It's more like what she didn't want me to try. I wanted to take dance. She flipped out and made me choose between basketball and hockey.
What does your dad say?
He seemed okay with it. Then he just caved into my mom.
Your palm is red.
What does that mean?
That we still don't know what's wrong with you.
Can I please get some information about our patient?
Patient's palms are red. Lab test confirmed liver and kidney dysfunction.
I don't remember you taking any Vicodin today.
I don't remember hiring my mother. And what causes the enzymes in little boy George's existing heart problem and pelvic pain?
You didn't take any yesterday at breakfast either.
I don't remember having breakfast with my mother.
Amyloidosis with systemic involvement.
Protein levels are normal. This kid's depressed. If he's self-medicating with drugs and alcohol, that'd explain his symptoms.
Search the school, search the home.
Seriously?
It looks like the vitamins my parents gave me. Same red top.
These aren't vitamins.
What is it?
I can't tell you that. You should ask your parents.
So what? Am I a boy or a girl?
Some of your cells are male, and some are female.
So basically, I'm a freak.
No, buddy. You're just a little different.
You've known this since I was born, and you never told me.
We didn't want you to be confused.
So you lied to me.
Oh, please, sweetie, we were just trying to protect you.
Don't. Just leave me alone. Get out.
Let's go. Eventually, you have to talk to your parents again.
No, I don't. I have this one friend. My basketball team, Will. We hang out a lot. I really like him. Now I'm worried that I, like him. Maybe I'm supposed to. Because if I'm really a girl.
Do you feel like a girl?
I like dancing more than basketball. Is that what that means?
Jackson. As hard as it is right now, at least it's out in the open. You don't have to hide behind a mask. I found the poem you wrote in your room. No matter how bad things get, killing yourself is never the answer.
This was an English assignment. We were supposed to write a poem in the style of Sylvia Plath.
You don't feel this way?
I'm sad sometimes. I don't want to die. At least I didn't. Are these antibiotics supposed to make you nauseous?
Yeah, they can.
Patient dead? Or do I need to do anything?
He's got scleroderma.
It's not scleroderma.
Wow. 2 days, you already got 2 separate theories.
You're back. Good.
We noticed a drop in AST levels. It's not from the anti-inflammatory.
It's because his kidneys got better from the testosterone.
Which rules out scleroderma.
When did you two come up with this?
We ran into each other in the lobby.
So what did we miss? When I say we, I mean you, 'cause I wasn't here.
We've ruled out Zollinger Ellison.
That was a dumb idea.
Why?
Because it was wrong.
Also toxoplasmosis, dehydration, SLE, various intersex disorders.
Oh, crap. This kid like energy drinks?
I saw some empty bottles in the team's locker room.
But energy drinks don't explain.
Nice work. This is all your parents' fault.
Excuse me?
Chug a lot of energy drinks before, during, and after practice. Your son came in here with simple dehydration. That's why he collapsed during the game.
The ER treated him for that. It didn't help the pain.
That's where the energy drinks came in. Put a strain on his kidneys, so he needed more time to rebound from the initial dehydration.
Then why isn't he better?
That's where your idiocy came in. Before we could give him another glass of water, you two insisted I do an MRI. So I go down a blind alley looking for a blind uterus, and my team injects him with contrast material. His kidneys have been healthy. We filtered out the contrast in a couple hours. Since they weren't, they went around and around, eventually getting absorbed by his heart and his liver, his pancreas. Getting in trouble everywhere it went. Your son was fine when he got here. It was your freaked out overprotectiveness that nearly killed him.
Nearly.
He's young. A few weeks of dialysis, he should be fine. You gave birth to a freak of nature. Doesn't mean it's a good idea to treat him like one.
No, we took him to the ER after the game. He was scanned, they tested him, he said he was fine, no concussion, it's gotta be something else.
You hound me for my opinion and then you question my diagnosis. Cool. ER obviously screwed up. Kid's got a concussion.
I had double vision before I was hit.
Well, that changes everything. You need glasses. That's why you had double vision, which is why you got hit, which is why you have a concussion, which is why you have night terrors. You need to see an ophthalmologist, which I am not.
You enjoyed that. I brought a reasonable case to your attention and you shoved it in my face just to humiliate
You're an
me.
only child, aren't you?
Why would you say that?
Because everything is about you. This may seem incredibly controversial, but I think sexual abuse is bad. I just wanted to make sure he wasn't being diddled by Daddy or Mommy. Anything else is just a bonus.
I'm not an only child.
Interesting.
What?
Don't move. Did I bore you in there?
What? No, not really.
Are you tired?
Sometimes.
He never sleeps. Of course he's tired.
Right now, at this moment, are you tired?
No.
That twitch in your leg. Did you feel that?
Didn't hurt.
His leg twitched. I don't see what
It's called a myoclonic jerk. It's very common when you're falling asleep. Respiration rate falls, and the brain sometimes interprets this as the body dying, so it sends a pulse to wake it up.
So?
So, he's not asleep. He's awake. Admit him.
I usually don't move during night terrors.
I'm not restraining you for them. EEG revealed abnormalities in your brain, caused nerve damage in your toes.
What are you doing?
Fixing it.
Can I talk to my parents?
Oh, they know all about this.
I'd really like to see them. Please. I'd really like them here.
This is gonna hurt, Dan.
Oh, God.
Dan, you okay? There are experimental treatments, ongoing research. Who knows what they'll discover in a year or two?
This is where I dropped the ball.
Dan, we're standing on the roof of the hospital. Dan. Dan, you're not on the field.
He doesn't know where he is.
Dan! Foreman. Dan.
Dad?
Dan, no!
Dad!
Show of hands, who thinks I'm not in my right mind? And who thinks I forget this fairly basic neurological fact? Who thinks there's a third option? Very good. What's the third choice?
No idea. You just asked if I thought there was one.
The patient has a shunt in his brain. There'll be no increased pressure. We can put as much penicillin into his body as we want.
Excellent. Inject him through a lumbar puncture.
I heard you found her on the roof.
You have very acute hearing.
You notify the parents?
In due course, of course.
And is there a paternity bet on the father of the patient?
Doesn't sound like me.
Well, it does, actually, but it doesn't mean you're guilty.
You think?
I saw the parents in the lobby. Smart money's obviously on the father.
My guy knows a guy who can get you in for $50.
Fine. Tell your guy if I win, you attend the faculty symposium and you wear a tie.
And if I win, no clinic hours for a week.
My guy will call your guy.
She's very good at her job.
How can you just sit there?
If I eat standing up, I spill.
Our son is dying, and you could care less. We're going through hell. You're doing nothing.
I'm sorry, you need to vent, I understand.
Don't be condescending. You haven't checked in on him once.
Blood pressure is 110/70. The shunt is patent, well placed in the right lateral ventricle. The EKG shows a normal QRS with deep wave inversions throughout both limb and precordial leads. LFTs are elevated, but only twice the normal range. Oh yeah, and he's hearing voices. Go hold his hand. Go on, I'll bust your tray. Got any sample bags on you?
I don't believe you. Gonna run DNA tests?
Your son is deathly ill. I know, it's terrible. The fact is, if I don't keep busy with trivial things like this, I'm afraid I might start to cry.
You're an ass.
Yeah? You want to double the bet?
I need an answer.
You idiots. You lied to me.
We didn't lie about anything. You, on the other hand, accused us of molesting our son.
Perfect.
Couldn't we get off my screw-ups and focus on theirs? Theirs is bigger. You're not Dan's parents.
We're his parents.
He was adopted. He doesn't need to know.
I do.
Adoption makes us just as much
Listen, when we were taking his medical history, were you confused? Did you think we were looking for a genetic clue to his condition, or did you think we were trying to ascertain who loves him the most in the whole wide world?
How did you find out about this?
I sampled their DNA.
We would give you any DNA.
Your coffee cups from the cafeteria.
You can't do that.
Again, why are we getting hung up on what I did? Your medical history is useless.
No, we gave you a detailed history of his biological mother.
Her history. Non-smoker, good health, low cholesterol, no blood pressure problems.
Dan was adopted 2 weeks after he was born. You have his history. There's nothing you need to know that we didn't tell you.
Sounds reasonable. Well, if you want to transfer your boy, that is your choice. I still think it's wrong.
Was she vaccinated? The biological mother, when she was a baby, did she get her vaccinations?
Dan was vaccinated at 6 months.
Mm-hmm. Do you know why kids get vaccinated at 6 months? Because before that, they are protected by their biological mother's immune system. So, was she vaccinated? An infant picks up a regular old measles virus. He gets a rash. He's extremely uncomfortable, has a wicked fever, but he lives. Here's the kicker. Once every million or so times, the virus mutates. Instead of Dan having a fever and a rash, the virus travels to his brain and hides like a time bomb. In this case, for 16 years.
Subacute sclerosing panencephalitis.
I know. There's only been 20 cases in the United States in the last 30 years.
Suppose you can make an argument the kid's still in stage 1. Once SSPE moves to stage 2.
Boom. Stage 2 is universally fatal.
I assume it's impossible to know when he might move into stage 2.
He's already started showing symptoms. Could be a month, could be tonight.
Can we treat it?
Ask the neurologist.
Intraventricular interferon.
Not going to shove a spike into his brain and drip interferon without confirming this diagnosis.
Tap him.
We won't get a reliable result for measles antibodies in his CSF, not after everything we've given him.
So the wrong treatment kills any hope of the right diagnosis. Why do people lie to me? Could also kill him. You're a ball foreman. Tell me I don't have to biopsy his brain.
Well, there's one other way.
You sure this isn't gonna hurt?
Yeah, it's just scary as hell. See, we go through the pupil. You won't feel it. The eye's been paralyzed. The needle travels to the back of the eye, which is where we'll perform the biopsy on your retina. So we've confirmed that the problem is this mutated virus.
Did you need something else?
Good news on your EEG. Treatment is working.
And your immune system is responding.
I know it's early. Just want to take a look. All right. Let's see what that brain of yours can do. Name as many animals as you can that start with the letter O.
Ostrich. Ox. Old elephant.
Well, it's two better than last time. How you doing with the whole adoption thing?
Been here since 5th grade.
How's that?
Cleft chin. I have one. My dad doesn't. Looked it up on the internet. It's one of those trait things.
That's right. It's autosomal dominant. Since neither of your parents have cleft chins, it's highly unlikely you're biologically related.
You sure you're okay?
I've got no problems with being adopted. I love my parents.